About 1 in every 20 kids struggles with a mental health issue.
And an upcoming event in our city will shed some light on some of those problems. Suling Go joins us now with more on this. Suling, one of the featured topics will be ADHD.
Yes, which only started to be commonly diagnosed in the 1980s. In the past, attention deficit hyperactivity disorder was dismissed as bad behavior. Now some say what used to be underdiagnosed is now overdiagnosed. His dad says Caleb Power has always been extremely energetic, curious, and stubborn.
It was very hard to change Caleb's behaviors. So if you didn't want him to do something and you tried to punish him with a timeout or something like that, yeah, none of that stuff worked.
Caleb would not take no for an answer and had trouble controlling his emotions. His teachers noticed he was either too focused or not focused at all.
They initially just wrote it up to bad behavior, and then they met with us and they were like, okay, you guys are actually doing a lot here, so there's something else going on.
With the help of his school, a psychologist, and a family doctor, Caleb was diagnosed with attention deficit hyperactivity disorder, ADHD. His parents felt it was the right diagnosis, but that's not always the case. Registered psychologist Tania Johnson says ADHD tends to be overdiagnosed.
We have a lot of parents who just feel completely overwhelmed. We go into a doctor's office, we do a couple of surveys with the teacher and with the parents, and our children are getting diagnosed too quickly with ADHD.
Kids born just before the school entry cutoff date have a higher rate of diagnosis. So do boys. Maturity needs to be considered, as does trauma and stress, before blaming a neurodevelopmental disorder.
Really what we could be doing instead is helping them with their anxiety or helping them with emotional regulation. But when we suddenly have a diagnostic label attached, we miss all of that.
Tania encourages parents to take their time, get several opinions, to avoid unnecessary treatments. Caleb is now in a special program for kids with a high IQ and attention issues. He also sees a psychologist.
I think it's helpful because, you can say how you've been feeling and can calm you down a lot.
His family feels Caleb can use his ADHD to his advantage.
Persistence, curiosity, and drive, they're all excellent qualities. We look for them in adults. But when they're kids and they're doing things that you don't want, then it's very challenging.
Statistics show ADHD affects anywhere from 5 to 12% of kids. The Children's Mental Health Conference is at the Edmonton Inn and Conference Centre from April 26 through 28. Topics include anxiety, grief, and divorce. Visit instituteofchildpsychology.com.